5 years ago today, the World Health Organization declared COVID-19 a global pandemic. Long-term care homes were among the hardest hit.
We need governments that commit the resources to do that. Not in 2 years, not in 3 years, not next year, now, actually last year. But starting now, we need those resources now.
That call to action was made at a protest in 2020. From March the 1st, 2020 to February 15th, 2021, more than 14,000 residents and nearly 30 staff died of COVID-19 in care homes, making up a disproportionate 43% of all COVID-19 deaths in this country. So 5 years later, have we made the changes that were needed? Susan Bradley is joining us now from Ottawa. She's an associate professor at Carleton University's School of Social Work. Good morning, Susan. Thanks for being with us.
Happy to be here.
So let's go back a bit. And we got to say from the outset, for many, it's still traumatic to look at those pictures or think about where we were 5 years ago. What were the biggest issues facing long-term care homes during COVID?
Well, really, it was long-term neglect. The long-term care system neglect was exposed by this. And so what were the conditions? Well, really, it's first important to understand that provincial government funding is provided to long-term care providers, and in most provinces that's a mix of for-profit, not-for-profit, and government-run homes. All of these homes had difficulty with, one, working conditions and having sufficient staff to care for people. Two, physical infrastructures that had been neglected, that were not adequate for infection control, and that put people too close together with shared washrooms. And three, we found that these conditions and many other quality problems were most evident in for-profit homes. Everyone will remember that the military was called into for-profit homes, big for-profit homes in Ontario and Quebec during the pandemic, and they found the worst conditions with people left dirty, dehydrated, alone, and in absolutely filthy surroundings.
So following all of that, what kinds of changes did people demand following the pandemic?
Oh, well, people demanded a lot of different changes, and governments did respond in some ways. So there's been some good initiatives at the provincial level, at the federal level, and at the level of individual homes. There are big differences amongst provinces. For example, in Saskatchewan, the government took over the very few for-profit homes that were in that province, and that was a good thing. The federal government has spearheaded the development of national long-term care standards. Everybody wanted that. They didn't deal with the for-profit issue in those standards, but they dealt with lots of other things. Unfortunately, in the agreements that the feds have to fund the provinces for long-term care, they didn't tie any money to meeting those standards. So I'm not sure where those are going to go. In Ontario, we had the Fixing Long-Term Care Act introduced by the Ford government. I wish it had fixed long-term care, but it did do a few things. One, it did set a standard for improved staffing levels in Ontario's long-term care homes. We haven't been as successful in meeting those levels as we'd like, but at least that standard's there. And the other thing is they provided funding to make sure that long-term care homes were air conditioned so that those fragile residents and those many workers are more comfortable in Ontario's sweltering summers. So there are many problems remaining, though, and we haven't tackled them yet.
It is still crazy to think that many homes didn't even have air conditioning, and it took the pandemic to really highlight that.
You know, I've been a researcher in long-term care for 15 years. I've spent thousands and thousands of hours in long-term care homes in Ontario, across Canada, and around the world. We can do this much better.
And we'll leave it there for today. Susan, thanks so much. Susan Bradley with the School of Social Work at Carleton University. Thanks so much for your time.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.